Today topic of discussion is herpes virus type 3 varicella zoster. One virus causing two diseases. Varicella causing chickenpox and zoster causing shingles. Chickenpox is the primary infection. Shingles is secondary infection or lethal infection after many years. As soon as virus entry, immediately it causes chickenpox, and after many years, latency or dormancy, it causes lesion. That lesion is known as shingles. First, we will discuss about varicella chickenpox. So, chickenpox is the primary infection, immediate reaction. Zoster is the causing shingles. This one, reactivation of latent virus. When immunity fall, that time only it will cause us latent infection. Varicella chickenpox causing agent varicella zoster virus, human gamma herpes virus 3, incubation period 14 to 16 days, source of infection cases, that means person to person, mode of transmission air droplet through respiratory. Sources of infection person to person, mode of transmission through air droplet through respiratory, spread droplet infection. What is the period of communicability? 2 or 5. 2 or 5. Here R is rashes. When rashes arises 2 days before rash and 5 days after rash. So they are the days the person infecting and infecting to others. So the rules 2 or 5. So there are the days, these are the days the person need isolation. 2 days before rash, next 5 days we want to isolate the person, otherwise easily spread others. Secondary attack rate 90%. So this person having chickenpox, he have contact with 10 different people. Out of 10, 9% was affected, that is 90%. 1% safe. So, and it show a cyclical trend every 2 to 5 years. So every 2 to 5 years it shows chickenpox. Chickenpox usually affected children's of the age group 5 to 9 years. So next, pathogenesis. Varicella zoster virus enter respiratory tract, then it replicate in the local lymph nodes. It goes to blood and causes primary viremia, then reach liver and spleen, then it causes secondary viremia, then causes skin rash, then it goes to dorsal root ganglion, remain there for years and years, and reactivation causes another disease. Name, the disease name is called as shingles zoster. This is the person, virus enter via respiratory. It go going in the lungs and lymph nodes. From lungs and from lymph nodes it will remain lymphatic. From lymphatics it reaches blood. From blood it can causes primary viremia. From blood it will reach to spleen and liver. So from blood it will reach to spleen and liver. Then it will going again to blood. After that it goes to the skin. Then um, it goes to the skin. This is the skin. It produce lesion on skin. This is the whole pathogenesis. So through virus it will enter. After that it will reach to first it will reach to lungs and lymph node. Then it will reach to blood. After that again it will reach to spleen and liver. Then again it will reach to skin. Again it will producing lesion. This is the whole pathogenesis. Next, clinical picture. 2 stages: pre-eruptive stage, then eruptive stage. Stage 1 name is called as pre-eruptive, before rash. Stage 2, eruptive stage. In first stage, the person will have fever, back pain, malaise, shivering. Here, no rashes. It is called as prodrome or pre-eruptive stage. Prodrome or pre-eruptive stage. Stage 2, patient will have rashes, typical rashes. Here rashes are superficial. Now we differentiate chickenpox and smallpox. Look quite similar. Here we want to discuss what is the difference between chickenpox and smallpox. Chickenpox, they have peculiar appearance, rose petal appearance. This one no peculiar arrangement. Second one is centripetal. This one starting at Ferriberry, then it reached towards the face. See that arrow, it started Ferriberry and towards the it reached to face, towards center, that is centripetal. What is centrifugal? Centrifugal distributions, it started around mouth, then spread periphery. This one started from periphery, then it reached causes lesion in mouth. This one started mouth, after that it will reach to periphery. Then third one is phleomorphic rashes. Because this one having various stage 1, 2, 3, all the form, pacules, vacuoles together, all the stage together presented. So phleomorphic rashes. This one non-phleomorphic, all of them are same stages. Then this one chickenpox is superficial and unilateral. If you burst that vesicle, both of them, this one unilateral. This one, if you burst this small box, this one is the multi-ocular. This one is uniocular. This one is the multi-ocular. Around vesicle it form inflammation. Around vesicles it form inflammation. This one no inflammation around that vesicle. Red color vesicle around rashes. This one it not this affect axilla part. This one not affected. This one mainly affected axilla. This one not affected axilla part. Affect palm and soles. Then rapid evaluation. This one slow evaluation. These are the main difference between chicken box and small box. But both are look wise similar only. These are the different these chicken bags and small bags have. Coming to complication, most common complication of varicella in children. Herpes virus type 3, because of itching, it will causes bacterial infection on skin, usually caused by uh, streptococci or staphylococcus. Extracutaneous complication in CNS. Most common complication in adult, it is due to pneumonia, affected lungs. Late complication is shingles, latent infection in both children and adult. So what are the complication? Secondary, because of itching, it will cause a secondary infection, bacterial infection caused by streptococcus, staphylococcus. Then most complication in affected in CNS. Then most complication in adult due to pneumonia. Then later complication, it causes shingles. Coming to shingles, herpes zoster. While varicella is typically a disease of childhood, herpes zoster is one old age. Pathogenesis, it is due to reactivation. It is due to latency. The virus dormant in the sensory ganglion for many years. Pathogenesis, this virus it is due to reactivation. It is due to latency. The virus dormant in the sensory ganglion for many years. The virus remain latent in the sensory ganglion after many years of initial infection. When the immunity is trapped, the virus reactivated and it travels sensory nerves and again come on skin and producing secondary lesion. So this is the primary lesion around the face and nose. The virus going through nose, going through nose, remain it dormant in sensory ganglion for many years. This is the latent virus. This one is the latent virus. When immunity trap because of fever, because of heat, surgery, anything, this virus get reactivated, again travel through nerves, come back and causes lesion. And comparing to primary lesion, this one is the secondary lesion is the larger one. Primary disease was chickenpox. Secondary disease is zoster shingles. See the different distribution of rashes. Varicella, whole body having lesion. Zoster, unilateral, either left arm or right arm, never cross middle line. This one never cross middle line. Whole body affected, varicella whole body. This one is unilateral, either left arm or right arm, never cross middle. Then clinical pictures. zoster severe neuritic pain. It is usually started with severe neuritic pain along with rashes. These are the two important features. Neuritic pain along with rashes. So it causes neuritic pain, then rashes, then it will causes ophthalmic zoster, ophthalmicus, then it turn into blind also. Sometimes complication it causes ophthalmicus, ophthalmic, ophthalmic zoster. Patient can turn blind also. It affect trigeminal nerves, so it leads to blind also. Second one is Ramsay Hunt syndrome. Sometimes it involves in facial nerves and inside ear tympanic membrane. Patient have rashes. Tympanic membrane also having rashes. That is known as Ramsay Hunt syndrome. So patient uh, inside ear tympanic membrane having rashes. This one name is called as Ramsay Hunt syndrome. So basically two nerves are involved, facial nerves and ear nerves. These are the two clinical features of shingles and zoster. Laboratory diagnosis, four way of diagnosis we already discussed in herpes simplex virus 1 and 2. Same method only, microscopic virus isolation, PCR and serological demonstration. Here also this where we want to prepare three important property: syncytia, ballooning and Cowtry typhi intra muscular inclusion bodies. Then virus isolation, all the things is same only. Then treatment, acyclovir and vidabin, acyclovir and vidabin. Prevention of varicella, two things available in market: immunoglobulin, varicella zoster immunoglobulin and live attenuated vaccine. Suppose this person having chicken pox, 2 days before rash this person contact with another person. Last 2 days this person contact, so he or she is spread. The second person already exposed. No rashes appear on this body. He will meet doctor. So now what will happen? Within 72 hours of exposure, they will give varicella zoster immunoglobulin is effective. It will give in the form of intramuscular injection and second dose after 3 weeks. So first one is intramuscular injection, first dose, after 3 weeks second dose. Number two, that vaccine is also available, live attenuated vaccines. This one is Vocastain, 90 to 95% effective. Vocastain. This one is 90 to 95% effective. Here also two doses. One is incident and after 6 weeks of first dose. Not give two things together: immunoglobulin, that is passive immunity, vaccine, that is active immunity. So not given together. Thanks for watching.